Hi, I'm Tara Pai, and this is my concept for images of a healthcare organization, Western Health. Western Health is a regional health authority, one of four in Newfoundland and Labrador. It serves a population of about 80,000 people over a broad geographic part of Western Newfoundland. Many communities in the region are rural, whereas there are some larger towns that have modern conveniences. Western Health was formed after the merger of two health organizations, Western Healthcare Corporation, the hospital side of healthcare, and Health and Community Services Western, the public health side. All health boards in the province went through the same integration in 2005, and there were similar logos and brand identities created. Each of the four health authorities have consistent left and right images of their logo, people and sunshine, and a unique middle image relating to the geography of the region. As well, all the health authorities have the dark navy color and a unique contrasting color. Western Health's unique images of mountains, trees, and water. Featuring a geographic related image in the logos doesn't convey feelings related to health or healthcare. Feelings of caring and empathy would be portrayed by people. The vision of Western Health is our people, our communities, healthy together. The images and branding of the organization should have very little to do with actual healthcare services and be about people and communities in the region. The world of healthcare and healthcare professionals can sometimes be seen as a secondary world. The language healthcare professionals use may not be easily understood by people who aren't working in that area or who have received healthcare before. Accreditation Canada, the organization which provides monitoring and evaluation for healthcare organizations, develops standards to ensure that person and family-centered care is a guiding principle for the organization. Support for meaningful partnerships for clients and families must be established in the organizations, and client and family representatives must be present on advisory and planning groups for the organization. The accreditation standards require that health organizations involve clients, patients, and families in the decision-making process for their care throughout all areas of the organization. Providing person and family-centered care means working collaboratively with clients and their families to provide care that is competent while being responsive to their needs, cultural backgrounds, beliefs, and preferences. The imagery of the healthcare organization should reflect this movement of person and family-centered care. The cost of healthcare is not sustainable. Compared to the rest of the province and Canada, the western region of Newfoundland, it has a higher incidence of chronic disease and a higher average age. A strategy to decrease the overall cost of healthcare is to reduce the need for healthcare services by improving the overall health of the population. The faces of people in our region who exemplify healthy lifestyles throughout all of life stages should be a part of the brand of the organization. The images should be simple and colors should be representative of what we see in our region. The elements of the landscapes and faces and communities in the western region should be part of the imagery in order to resonate with people in the region. The images should reflect the residents' primary world rather than the secondary healthcare world. One way we can improve health is to get people outside. It would be common to hear in Newfoundland that people do not live here because they love the weather, unless they prefer extreme cold and harsh wind. We are a hardy people who are accustomed to long winters. What people love about the province and region are the people and the communities. In fact, there's a strong sense of belonging felt by residents in our region. To resonate with people in the region, the branding of the organization should reflect our people and our communities, not buildings and stethoscopes. Images of people enjoying the outdoors and all types of weather should be part of the branding of healthcare in Western Health. There's an increased recognition that individuals are responsible for their own health and well-being. Many of their programs are moving in the direction to provide education to people about how they can take care of their conditions. For example, if you have diabetes, you have a responsibility for monitoring your symptoms and maintaining your blood sugar levels, either through diet or medication or exercise. The images in the healthcare authority should reflect the people rather than services to help them understand their role in maintaining their health. There are many beautiful scenes you will experience when exploring our region. Exercising in the outdoors has many benefits, including improving focus, enhancing creativity, reducing stress and anxiety, improving sleep, and reducing risk of chronic disease such as heart disease, high blood pressure, and diabetes. These are images of trails you can hike or walk in western Newfoundland. This trail is in Grossmore National Park, the Coastal Trail. This is another trail in Grossmore National Park, the Tablelands. Encouraging people to stay active in their communities in the facilities provided by nature will improve their health and reduce their need for healthcare services. Many of the towns in our region do not have gyms or indoor facilities for exercise, and it certainly may be easier to stay bundled up when the snow is falling and the wind is raging. But getting outside often, increasing heart rate and fitness levels will improve overall health. Hunting and gathering was a source of food in Newfoundland and Labrador for many generations. Fresh and free fruits and vegetables that are grown here provide nutrition that many people would hesitate to buy because of the high cost. To improve overall health, emphasis should be given to sourcing food that is locally grown. The images of the health authority should be reflective of that concept of growing your own. The rich color of the berries grown naturally in Newfoundland and Labrador would provide natural beauty and colorful imagery. Being on an island and on a coast provides many opportunities for people to enjoy activities on the water. This is a common sight you would see around the western region of Newfoundland, and one that reflects a common pastime. Using similar images in the branding of the healthcare organization would be appropriate. Maintaining health throughout all stages of life will help contribute to a healthy population. When healthcare is required, the healthcare professionals will provide care and support to help people maintain their health. Images of the organization will reflect healthcare professionals and the people receiving healthcare as partners in the efforts made to improve health. When someone is receiving healthcare services, the healthcare professionals will work with them to plan their care that suits their needs and preference based on the person and family-centered approach. Maintaining social connections is important to healthy aging. This is an image I took at an event at a long-term care home. This is a manager and resident of the home chatting and enjoying ice cream. These are the type of photos that would represent the care that staff provide to people who need healthcare services in the region. Healthcare is constantly changing, making improvements and changing the way programs and services are delivered to meet the needs of communities. As individuals, we're all on a journey in our own lives, making decisions that impact our health along the way. The images in Western Health's brand should reflect the journey taken as improvements are made in health individually and the overall health of our communities.